Hello viewers, I am Dr. Ravindran from Bone and Joint London Medical. Now where is this Bone and Joint London Medical? It is in Coimbatore near Ambal service station near Andal Mandapam on Trichy Road. I have trained I qualified from Coimbatore in India. Then I have trained in over 60 countries, got my qualifications in several countries. And I traveled over 60 countries in different fields of orthopedics. Likewise in UK, in New Zealand, in Australia, in Switzerland, in Sweden. There's so many other countries which I have visited and practiced and seen thousands of arthritis patients. Having finished there, I come to settle down in India to practice orthopedic surgery. Now what we are going to talk about today is arthritis and how can you manage arthritis in a simplistic manner. There are different ways. There are different ways the arthritis can set in. But let me tell you, it's a common thing how it sets in is because of the age factor. The increased weight and the age factor, probably from 35, 40 onwards goes on, 40, 45, 50, some of them maybe 60, 70. And there are patients who come in at very early stage with arthritis with severe crippling also. Can be due to rheumatoid arthritis, can be due to infection. In a case of a fracture, if it's not properly set, the joint is not properly set, and that can lead to arthritis. So there are several reasons, but what we are going to concentrate today is a common arthritis which happens in the age phenomenon. Now what are the symptoms that can develop? Commonly, swelling, the joint gets swollen, pain is an important factor, pain getting up from out of a chair, pain walking on the floor on an irregular surface, on walking on a stairs, getting out of the car, maybe lying in bed, turning in bed, all sorts of things can cause pain, and the pain can increase. And you can see patients who can hardly walk about 100, maybe 200 yards, and they were restricted with severe pain. Deformity, gets deformed, swollen, redness, angry, all these sort of symptoms can arise. Look at these x-rays. Just look at that x-ray now. Look at this joint space, that is a gap. Now that's a joint space. Now that is intact, which means the arthritis is not much, the joint is quite normal. But if you look here, it's a different patient, and you see that there is no joint, there is no gap there, which means that there is no joint space and the bone is rubbing on bone. That's quite severe arthritis. Having seen those x-rays, now you see the difference how the normal x-ray and an arthritic x-ray. We don't need MRIs, all these fancy investigations. Just a simple x-ray will sort out. Now how can we treat this condition? There is a stigma that once the arthritis sets in, it will go for surgery. No, it is not. Very commonly arthritis is treated with medications. Very rarely it comes with surgery. Let me give you an understanding. 1 out of 100, I would say bluntly, 1 in 500 will come for surgery with an arthritis. So arthritis for surgery, it's not that common. You don't need it. Or if it is done overly, it's an overkill. It can be treated with so many other methods of treatment, which is the medications. And right now there is lots of medications which can control the arthritis and treat the arthritis. Let me list you a few of them. Boswellia, Aflapin, Curcumin, rosehip extract, all these so many things, glucosamine, chondroitin, diacerin. There are so many other tablets are available and medications available, collagens of different sorts, collagen peptides, undenatured collagen. All these can work in some patients and some of them work in other patients. So it is like having a BP, blood pressure. Don't expect the same tablet to work all patients. Some of them do work in some patients and the others on the other patient, but it does. Gives some dramatic recovery in so many patients. In spite of all that, some of them don't respond, and those are the ones which will go for a different modes of treatment. Some exercises, training, muscle training, joint training, all this will improve and the patient can dramatically improve. Now that you heard about what is arthritis on the basic situation, you can contact me at the Bone and Joint London Medical at Coimbatore. Thank you for watching.